Good morning. This is a lecture about school nurse-led case management, SNLCM. This lecture is based on a model for school nurse-led case management document that you have in this week's module. And specifically, this looks at and provides school nurses with guidance and resources to support the school nurse in providing case management for students with chronic health conditions. The idea is for us to be able to manage students with chronic health conditions, but also knowing that we can use the same actions provided and resources provided in this manual for all students, even without those without chronic health conditions, but knowing that students with chronic health conditions are the ones who we focus our energies on most of the time because they are pre-identified, they are in need of our assistance, and they are just by virtue of their chronic condition the highest priority. And so in full disclosure, I worked on developing this manual, this model with NASN, National Association of School Nurses, and with in conjunction in partnership through a grant from the CDC. And so the idea was to minimize barriers for students with chronic health conditions to get them into school. And so we wanted to provide a way for nurses to provide case management. Something you should know is that this is not rocket science. This is not something that is so earth-shattering that you're going to say, oh my gosh, I can't believe I've never done this before. This isn't. This is very, very basic. But the idea behind this is to provide some kind of framework or specifics for school nurses to be able to implement and carry out case management in a methodical, sustainable, standardized way, right? So that you're doing all of these things. It's just that you aren't labeling them case management. And so the idea behind this is that you are able to kind of put them more into a category and to say, okay, these are case management actions. These are the things I should be measuring related to case management. And so that's what this is meant to do. All right, so the first thing to think about is, what is the purpose of school nurse-led case management? Well, first of all, what about school nurse-led case management? Well, the reason that we named it school nurse-led case management is because this is the care that's provided that you lead as the school nurse. You're not part of the team. Well, you are part of the team, but you are leading the team in the case of school nurse-led case management. At its core, school nurse-led case management involves what we're calling the highest form of application of the nursing process. As I said earlier, this is not rocket science. This is simply the nursing process put into action. But it's the highest form of application of the nursing process. We all know we do the nursing process every day. You know, we think about it, we do it, we carry it out, but we don't necessarily think about the steps and are being methodical about those steps and carrying them out in full, right? And writing them down and measuring them. So, the focus in this case, as I said already, is the students with chronic health conditions. But this process can also be applied to students with social, mental, and acute conditions and concerns for specific students and or student populations or populations of students. So this manual and the model describes school nurse-led case management and its benefit for students. The whole idea is to guide school nurses and school nurse leaders to implement those pieces of school nurse-led case management into a formalized program so that you're measuring things, you're doing specific things that you can then measure. It outlines key components of school nurse-led case management and provides strategies for implementation and evaluation so that it can be sustainable for later on. School nurse-led case management assists students with health-related needs to successfully manage their needs. It helps to reduce those barriers to academic performance and increase student engagement. It provides a consistent approach to care that reflects that full scope of professional nursing practice for our most vulnerable students, those with significant physical and behavioral concerns that impact their attendance and their academic success. And when I mentioned the full scope of professional school nursing practice, that is, as you know, from in this course, we look at the scope and standards of practice book and the specific components of competencies for school nursing in California. You are expected to practice at your full scope. So technically, if you're not doing case management right now, that means that you are not living up to your full scope of practice. You're not living up to your level of licensure, and you should be. I suspect that all of you are doing this. You're just maybe not doing it in a formalized way. And so we want to bring this out to say that this practice is being specific to a full scope of school nursing practice, which was one of the goals of the Academies of Sciences and National Academy of Medicine and Nursing 2020. And so now we're into 2030, but in 2020 it was that nurses in general practice to the full level of their skills, ability, and education. And so this is one way of doing that. Right, so this manual and this practice, this model, is built upon the foundational work of the NASN's 21st Century Framework for School Nursing Practice and the standards of the whole school, whole community, and whole child WISC model, which is the CDC and the ASCD. And then also it aligns with the multi-tiered system of support, or MTSS framework. And that framework is very much aligns with the levels of prevention in public health practice. And we'll talk a little bit about this as we get later into the lecture more. The states of North Carolina and Washington have both been carrying out school nurse case management services for many years, and so we built this model on some of their best practices and lessons learned over the years as well. Okay, so the definition of case management is a little bit convoluted and complicated. Remembering that case management is one of the practice components of the care coordination principle, which is one of the 5 non-hierarchical principles of the framework for 21st century school nursing practice by NASN. The other principles are public health or community health, leadership, standards of practice, and quality improvement. As defined by NASN's framework, the practice component of case management is a collaborative approach to providing and coordinating school health services. And so you're not doing this by yourself. It's collaborative. It involves the child's personal, meaning the student themselves, the family, their community healthcare providers, and the school, which is also the student and family healthcare providers, and their instructional support personnel. All of those health teams are involved in case management. And case management strategies help deal with, prevent, and reduce the occurrence of health problems and help to find solutions both inside of and outside of the school and within the traditional healthcare system and outside of the traditional healthcare system, such as things like transportation, housing, and food security concerns. So it's more than just getting them to the doctor. It is a full scope, comprehensive, and collaborative type of practice. The strategies that are implemented are proactive. As I said, they're comprehensive. They promote self-care of the family and the child, independence of the family and the child, and they address health and academic goals and are outlined usually in the student's healthcare plan, although not always, but that's the idea, is that the child has a healthcare plan that lays out all of these different comprehensive types of goals. Case management, you need to know, is systems level care. It's not a specific or certain intervention that you carry out. It's not a single person carrying out interventions. It's a continuous process of looking at goals, building goals, achieving the goals, managing any setbacks or barriers to those goals throughout the child's education or during their time where they need this care coordination and case management. So as I mentioned, North Carolina and Washington both were already carrying out case management in their school settings. And North Carolina has a very robust school health program in their state. They have six regional state level nurse coordinators, where we don't even have one. And our one is recently enacted and hopefully will be hired soon, or maybe is, and I don't realize it. So they have they're quite a bit ahead of us in terms of their school nursing practices statewide, at the statewide level. And Washington has had this in place for a while. I'm not sure they have as robust a program in Washington state, but they do have a program. Hopefully, and so we aligned this model with these two states' programs that were already in place. And so the definition in North Carolina, the definition of case management is the intentional use and documentation of the steps of the nursing process in a manner that achieves individualized health and educational goals. Right? Not rocket science, use of the nursing process. But again, you might be doing this, but you are not necessarily doing it in an intentional manner, right? And so that's the intentional use. And so that's really an important word in that definition. And then in Washington, it is the process by which the school nurse identifies children who are not achieving their optimal level of health or academic success because they have a chronic condition that is limiting their potential. It is based on a thorough assessment by the school nurse, including input from family and teachers. So some pretty good definitions for us to go through, to utilize. All right, so the goals of school nurse-led case management in the schools for students with chronic health conditions are to provide healthcare coordination to improve their outcomes, to foster their self-management of their health conditions, to increase their attendance, to support their academic success, and then to engage and support the families, right? And so these are very basic things, but remembering these goals is really, really important. So, you can print out this slide and stick it on your wall. And when things come up where you say, I'm not sure if I should be focusing on that, and you say, yes, that meets one of the goals, so I am going to focus on that. School nurse-led case management also provides professional support for school nurses, for you, and for health services stakeholders. So that is anybody who is a stakeholder in health support services, by improving the quality of nursing services, by contributing to the understanding of the impact and value of school nurse services in schools. Like, why are we important? So having this program helps to support why we exist and what impact we can have on kids. And then it also provides data. If you have that, remember the idea is that we are methodical and we're keeping track of and we're documenting all the things that we do for stakeholders to realize the value of the case management program and in school nursing in general. Remember that the school nurse works collaboratively with school staff, healthcare providers, child and family serving community-based agencies, and any other stakeholders that are out there to provide equitable access to academics for students who face those health challenges. Right? And ultimately, school nurse-led case management aims to optimize health and wellness so that students are healthy, safe, and ready to learn. Right? Those are our mantras and the reason we exist. So if it's not for the students and getting them back in school, then why the heck do you have school nurses? So let's talk a little bit about the target population for school nurse-led case management. We know that, and this is the multi-tiered system of support, which we know is similar to that three-tiered public health model that we learn a lot about in our world. But if you think about it in that way, it is easy to understand MTSS. So although case management processes can be used for any students, as I've mentioned, any students with health, attendance, or academic concerns, individualized case management is most beneficial for students with multiple and complex barriers to health and academic success. And those students are more susceptible than in general to inequities in health and healthcare access. And so MTSS is that three-tiered, stems from that three-tiered public health model in providing universal supports for children at Tier 1. So all children would get Tier 1, so that's, same as Level 1. We would provide supplemental supports into Tier 2 and intensified supports in Tier 3, identifying and addressing the needs of Tier 3 students with a chronic health condition removes barriers, allowing for inclusion and equity necessary for these students to reach their full potential. Tier 3 students are identified through what's called case finding. And case finding is a component of the Student Support Services programs, which is required through Child Find and in IDEA, right? So you might have a system in your district for Child Find. And I would encourage you to find out what is the system of Child Find in your district. Each district needs to have that in place. Some districts do it through a preschool special ed program. Some do it by having clinics. It's also done by these list of ways that you would be involved in Child Find. School nurses who participate in Child Find activities are doing case findings when they identify and prioritize students who have health conditions who might benefit from case management services. And many sources of data exist in schools to assist the nurse in the process, including these: nursing assessments, looking at student health history forms, their attendance reports, their grades, how often they come into the health office, do they have discipline problems, any referrals that come through. And the realities of the school nurse practice are that there are circumstances in which school nurse staffing is low. There are other priorities pulling at you. And so your resources are limited, of course. So therefore, astute nursing judgment is needed to prioritize your limited resources for school nurse-led case management to those students who are most likely to benefit from it. It doesn't mean that you're rationing anything. It just means that you are prioritizing. And the priorities, remember, will shift depending on circumstances and the day and the student and the time. And so, unfortunately, students that require Tier 3 services should be prioritized. And you're going to consider these priority categories. So the highest priority students are those with physical, emotional, or mental health conditions that are most likely to cause actual morbidity and mortality. Now, it doesn't say that those in high priority or priority aren't most likely or likely to cause morbidity and mortality, but these are most likely to. And then these same students in the highest priority are students significantly adversely impacted by the social determinants of health, social emotional factors, comorbidities, or other risk factors. And if you know from Nursing 2030 that just came out from the National Academies of Medicine to look at where nurses can most greatly impact student and patient and community areas, it is at impacting the social determinants of health. What the National Academies of Medicine determined was that we have a great impact as nurses on the social determinants because we are in the community setting. There is going to be, in the next 10 years, a shifting of the focus from, acute care and inpatient back out to the community. And there has been a shifting over time. Community health, even in times of pandemic, is, of greater importance and greater potential for impact. And so that's where you will fit your priority setting when you are looking at students to case manage. Then you're going to shift to the higher priorities or high priority students. Those are those same students who have physical, emotional, mental health conditions, and maybe they have increased absence rates or who are disengaged from the learning process. And they have some potential to cause morbidity and mortality. And of course, they're impacted by those other social determinants, but there's judgment call on where they fit into that high priority versus highest priority. And then finally, your high priority, but they're just priority. So again, not that they are not significant. You use your judgment, your assessment skills. These are students that are at risk, increased risk for physical, emotional, or mental health conditions. These are more at risk for. These are students with. And these are students who are most likely to cause. But they all have physical, emotional, or mental health conditions. And these for whom services may prevent poor outcomes. This is the hardest part, I think, is deciding who gets what services, right? So school nurse-led case management is an example of advanced application of the standards of practice and the nursing process, infused with the key components from the frameworks of the WISC model, the framework for 21st century school nursing practice, and MTSS. And this particular slide is from the model developed for the North Carolina Healthy Schools, and this is their school nurse-led case management model. And so it was brought in as a model for this particular handbook and practice. It can be utilized any way you feel it works for you. Again, students are found here under student case findings, and then there is a nursing assessment is performed. And remembering that school nurses, our level of expertise, our number one thing that we bring to the school setting is our ability to do assessments, high-level assessments. That's what we do. We are skilled at assessments. School nurses bring their expertise in health assessment to the school setting. So we gather both subjective and objective data. But as you know, the nature of the school environment as an educational setting versus a healthcare setting often changes the focus and composition of the assessments that we perform. And you learn a lot about this in your 524 class. So if you're a nurse practitioner or a pediatric nurse practitioner that did not take the 524 class, what we focus on in that class is assessments that are outside of just a head-to-toe assessment, physical, outside of just a focused physical assessment to kind of an all-encompassing assessment of the child and their family, to specific assessments like nutrition and social emotional assessments and behavioral assessments. Common to a nursing assessment conducted in other settings, the components of an assessment in the school setting include past health history, family history, psychosocial history, a review of the systems, and then a physical exam. And of course, we modify our nursing assessment in the school setting for students with a chronic health condition to gather relevant information about the child's overall well-being and their current health status, including their self-management of their condition, their success in school and activities overall, and additional areas for students with chronic health conditions, which would also be for students who you have in the tier 3 that may not have a chronic health condition, might include these assessment areas. Social determinants of health, including conditions in the places where the students and their families live, where they learn, where they work, and where they play. So not just their immediate response or their house. It could be where what's their environment like, what the playgrounds, and what's the shopping like in their area, kind of an environmental assessment, those kinds of things. And then looking at the school environment, what's their class schedule? What activities are they involved in? What are their educational plans in place? What are other academic indicators? Another assessment might be specific individual factors for the child. What are their social needs? Were they exposed or have they been exposed to adverse childhood experience or ACEs? What are their strengths and resiliency factors in place? What is their developmental level or their self-management skills? And then also you might assess their actual or potential impact of their health condition on their academic achievement. Things like poorly managed blood glucose. That's a really good example for this one because often we have those kiddos who are way out of control, and it has to do with their ability to care for themselves, their family's ability to care for them, etc. So as you know, you want to adhere to what the rules around assessments are. And in California, there are ed codes about this, which you learned from looking at your legal activity, is what are the legal obligations that you have to notify a family about doing a health assessment. There is passive acknowledgement through the student handbook that Ed Code gives you to be able to assess any health condition where you feel the child may be impacted without seeking positive positive approval from families. So they give passive approval for that just by your existence, and that's in Ed Code. And of course, you wouldn't do an assessment on private areas of the child unless you legally it's deemed emergent, or there's a need for that based on the assessment that's being done. One thing we don't talk a lot about in this particular class, because every district is different, but we do need to consider documentation of the assessment data, that it needs to be organized in a manner that is for nursing practice, a standardized manner. Most districts don't have this, or some, well, actually I shouldn't say that, because many districts do. I know that many of you use EHRs in your districts, and so you need to document so that things are consistently done. So if there's some kind of record that doesn't work for you and you need to work with the companies to make sure that your nursing assessment documentation system fits with what you're doing, then definitely I encourage you to do that. And it may be categorized in different ways. It may be categorized by a head-to-toe category, or a body system category, or a functional health pattern category. And there are lots of different ways, non-electronic ways out there. But the point in this whole thing is that everybody should be doing it the same way. And I know that in my previous district, we were not always good about all consistently documenting because of the scattered nature of our practice. And so one person would document one way and store it in one place and on paper, and another person would document it and carry it with them. It was just very chaotic and not very, not appropriate. So I encourage you not to do that. All right, so when we talk about nursing diagnosis, this is determined after the school nurse critically analyzes the assessment data, and they do the critical analysis when in collaboration with the student and the family. The nursing diagnosis provides a basis for determining what the focus of care should be for the student. It should be a student-centered focus of care, right? The development of the diagnosis is based on the student's current health condition and their immediate needs. So it's always the priority is their current problem. Again, nursing diagnosis is not a medical diagnosis, but it is a student response to the medical diagnosis. Things that require attention for interventions at school. So how is the student responding to the diagnosis, and what are the interventions that are needed in order for the student to be able to be at school and attend to school? Now, you should note that NASN doesn't support any particular taxonomy for developing nursing diagnoses, so you could just make them up as you want. We aren't using NANDA, we're not using whatever. You could just write up what are the current problems, what are the risk for problems, and then what are the problems related to health promotion, potential or real problems. And so you're just writing these categories for nursing diagnosis as you see them, right? And they should be you should consider these things as you write up into these categories. Student safety, how the issues are impacting the students' basic healthcare needs, the students and the families and the school's ability to help the child manage their issues, any conditions that interfere with learning, and other issues that impact the student's quality of life. All right, so you know that they fall into those three categories of current problem, risk for problem, or related to health promotion. And the student's needs and capabilities may limit your diagnoses that can be addressed in such a limited time frame. If you have a child that's severely handicapped, that may not meet all of the goals or any of the goals. So you need to develop your diagnosis based on things that are reachable, or maybe the idea is that it's a long-term relationship building diagnoses or goal for the child. You remember, as a school nurse, you see children over several years, and so your diagnosis could be long-term, and then you can expand upon it, or you can develop it to be changed over time or as needed, unless it's not needed anymore and the goal is reached. All right, the next thing to think about is the plan of care, right? So the plan of care includes adapting healthcare provider orders to the school setting, and also implementing independent nursing actions that support the goals, health and academic goals that were identified during your collaboration with the student and the families, right? So you develop those goals with the student as developmentally appropriate, and with the family and with other providers of care and education within the school setting. And so you're doing doctor's orders and then independent nursing actions. And so the structure of the components of the IHP and the ECP, the Individualized Healthcare Plan, and the Emergency Care Plan are particular to your practice in your district. Like some districts might use IHPs and ECPs interchangeably. Some use one more than the other. Some never use healthcare plans. In my district, we only tended to have emergency care plans and not healthcare plans. So if I were going to do case management, I would need to set up a system of individualized healthcare plan for students. So in some students will have an individualized healthcare plan or an emergency care plan as part of their 504 plan or their IEP. And so it really is particular to what's going on in your setting, right? But it needs to be interdisciplinary. It needs to be aligned with the doctor's orders. It needs to align with any legal documentation of the 504. And then it also needs to include school nursing interventions that are separate from the doctor's orders. So when a student's health issue impacts access to education or the ability to learn, information from the individualized healthcare plan can be used by the school nurse to inform the development of other education plans, such as the 504 or the IEP. And so your input really does have a big impact on how the student's IEP and 504 are developed, and vice versa. So next we have creation of goals and outcomes, right? So the next step is the development of the student-centered plan of care, is developing goals, and again in collaboration with the family and the student as developmentally appropriate, and with any other interdisciplinary providers, including educational specialists or any other providers of care in the school setting. Developing student-centered goals parallels the outcomes identification step of the nursing process, right? So in the nursing process, we gather our data, we do a nursing diagnosis, and then we identify what those outcomes are that we want the student or the patient to achieve or reach. What do we want them to end up with at the end? And then we build back in those interventions that help us meet those goals. So case management goals for students with chronic health conditions are designed for reaching optimal wellness and promoting self-care and independence, as, of course, developmentally appropriate depending on the child's abilities. The goals define what the future or resolution of the health focus identified in the nursing diagnosis will be for each of the students. Goals provide direction for planning evidence-based interventions, and they serve as criteria for evaluating your progress along the way, right? So if we didn't have a goal, we wouldn't have any way to measure whether we've met that goal and how well the interventions are helping us meet that goal. Goals are broad and long-term. So you would say something like by the end of the school year, or by the end of the calendar year, by the end of the semester, and they should always be written using the SMART format. And there are resources in this week's module to give you some information about SMART format. You can look up YouTube videos about it. There's tons of information out there about SMART format. And SMART stands for specific, measurable, attainable, realistic, timely, or time-limited. And then in terms of outcomes are referred to sometimes as objectives. They are the measurable behaviors and or benchmarks that have actionable steps that indicate progress towards meeting that overall goal or that optimal health state, right? So you see in IEPs that teachers have one overarching, or schools, specialists, whoever the people are setting goals on the IEP, have that overarching outcome measure or objective. But then they have benchmarks along the way that help to know where you're going. So you could set your goals up in one of two ways, or one of many ways. One is, have one overarching goal, and then you just see how well you're getting there. Or you can have one overarching goal with several benchmark measures along the way that you're trying to meet. So, that the child will hold the toothbrush, and then that the child will put the toothbrush in their mouth, and then that the child will brush their teeth. Those are kind of 3 stages, meeting the goal of child will independently or with assistance brush their teeth, right? So it takes a little practice, but you can get to that point. These should be, again, written in that SMART format. And I would say, and the book and our manual says, to consider developing standardized lists of goals or outcomes for each chronic health condition that you can use over time. And you will note that teachers and other providers in the school setting who develop IEP benchmarks and goals also kind of have a set of goals. Now you're going to say, oh, but it should be student-centered and individualized. Of course, they are totally individualized. Not every child needs their teeth brushed. And some children might hold the toothbrush in their hand for 30 seconds, while others might not need that time frame built into their goals. So remember, it is individualized. It's just that developing a list of goals and outcomes might be good for you to be able to draw from when you build your IHPs, and you not have to reinvent the wheel every single time. That's kind of the whole idea. And so next is to look at our interventions. Right? The nursing diagnosis and those related goals and outcomes guide in the planning of the evidence-based interventions or strategies that we use in the IHP and the ECP to help the child meet that goal, or the family, or whatever it is that you're working on. The school nurse determines strategies and interventions supported by the evidence to best meet the needs of the student, the health needs or the social needs of the student. And remember that evidence-based practice is best available research, which is peer-reviewed, journal articles, information from highly regarded websites or professional organizations, the Mayo Clinic, National Association of School Nurses, California and other state organizations, as long as you're adhering to the laws of our own state, universities, that kind of thing. Information, research, information, and resources. So just because it's on a website doesn't mean that it's not okay. It's just that you want to be sure that you gather information from websites, that there's a way to seek out whether or not it's evidence-based. So if you're using somebody's form or their practices, you should be able to speak to why that is evidence-based or why it's best practice. You wouldn't want to just start doing something just because it looks good. You need to know the rationale behind it. Evidence-based practice is also about student and family or patient preferences. And also, finally, what are the resources that we have in place? So you have best evidence, preference, and resources. So you might have the best evidence, you might have family preferences, but you might have zero resources to carry it out, right? So those things have to balance each other, and you have to be able to do the best you can with what you have. Those things will support your clinical decision-making when you're planning your interventions to help the student reach their goal. You want to intentionally plan interventions that focus on the child's needs and not on their diagnosis. So, for example, a child, there's no such thing as a student with seizure disorders, IHP. There's not a standardized IHP. There's only an IHP for an individual student that has a seizure disorder based on that child's unique needs. Now, of course, we all want to use something so we don't have to reinvent the wheel each time, but the idea is that you are developing a care plan specific to a student that has their needs in mind. It's also important to note that healthcare provider orders guide our routine and emergency medical care that we provide at school, but planning how the healthcare provider orders are implemented at the school requires you as a school nurse to critically think and take into consideration the synthesis of the assessment data that you've gathered, and the patient and family preferences, and then the nuances of the learning environment. And so just because the doctor wrote orders for you doesn't mean that you just stick them in a folder and say, okay, these are the orders. If there are things about those orders that are not fitting with patient preference, not fitting with the assessment data, not fitting with the culture of your school district, then you need to get on the horn with the doctor or the provider, nurse practitioner, PA, and talk to them about it. And how can you adjust those doctor's orders to fit the needs in the school setting? I'm so disturbed by school nurses who take orders, glance at them, throw them in a book, and never really think about it. And so it's your responsibility really to look at those orders and gauge where they fit with the child's needs in the assessment data that you've done, even if you're super duper uber busy. That is really an important thing. And one of the things I'm thinking about in particular are diabetic orders that have the box check that say RN only care level. Now, is it needed? Can the child be cared for by someone other than a registered nurse? Now, not that I'm saying the child deserves less care, but remember that the idea behind all of this is that the child becomes more and more independent as they get older and older. So if this order came through for an 8th grade student that has had diabetes since they're in 1st grade and it says RN only care, I would wonder, because I would not want to be called to an 8th grader who's a typical 8th grader cognitively to do their care simply because that's what the doctor ordered. I would question the doctor. I would find out the rationale for the order. I would talk to the family, and I would make sure that the order is progressively changed so that the student is independent more and more during the school year. That is appropriate. That is what you should be doing. And I know that this comes up a lot with nurses saying, no, I'm not going to change that. In our district, we were very, very big on making sure that students were becoming more and more independent, not because I didn't want to do my job. I was always available for them. I might have been on campus, but that the child becomes more and more independent while they're in school so that they don't have to depend on waiting in the office for me to get there. That's a social issue and a psychosocial issue, and that's not okay. Okay, so student-centered plans of care may also include evidence-based interventions that are not linked to provider orders. And those are the things that are on this list here. These are things that you might do that aren't what the doctor told you to do. Nursing interventions are a lot of what drive our care in the hospital, and they also drive our care in the school setting. You develop the IHP, of course, collaboratively with the student, the parents and caregivers, the healthcare providers, the school community, and any other people as appropriate to individualize that plan of care to provide for the continuity of care while the student is in school. And it's up to you to continually manage that plan of care and then evaluate the plan of care to see if the child has met their goals and whether the objectives need to change over time, right? So this is like a lot of what we do in research and scholarly work is we continually evaluate. We put in place an intervention and then we evaluate. How well did it work? Remember that evaluation is a systematic, dynamic, and ongoing review of the child's student-centered plan of care and their progress towards meeting their goals. What were their successes? What are their challenges or barriers in implementing that plan? And then evaluating their outcomes. So depending on what their outcome is. When goals and outcomes are written in this SMART format, the evaluation plan is already in place, right? Because we have we know the time limitedness, we know the time, we knew that what the goal is, what the steps are. But the evaluation planning should also include planning for ongoing evaluation of any of the delegated tasks that you have other designees doing for you. So if you have somebody doing tube feeding for you, somebody looking at a child's carb counting in the health office for you, you want to see how well those interventions are helping the student meet their outcomes as well. And so remember that this cyclical nature of the nursing process is demonstrated as ongoing evaluation leads to the continued assessment of the student's health status and the progress towards their goals, and then the revision of the plan of care as needed. So you measure it, you see how well they're doing, you intervene or change the interventions as needed, you revise the plan of care, and then you implement, and then you measure that revised plan of care at the time frame that you have designated. As developmentally appropriate, the nurse also, you can help a student monitor and modify the plan along with the student, right? So if they're not meeting their goals, you pull them in, you talk to them a little bit about what their goals were and how they can help you help them meet their goals. Okay, moving on to our at a glance. So in doing this model, we developed kind of a checkbox system for nurses to be able to quickly look at where you are in the process and have you met all of the steps of the process. And so this is just meant to be kind of a one-stop shop, quick at a glance for you to carry out case management. This is in your manual. And then we also have kind of a step-by-step in helping you to sustain your case management program in the school setting. If you are a nurse manager, to share with your nurse manager, or if you are not a manager but you're a school nurse and so you are designated as manager, to sustain your program once it's in place. So you can refer back to those things as needed. So remember that it's really important, again, to demonstrate the value of this program, of a case management program. It's critical to identify sustainability strategies when you're building and sustaining a case management program. You want to identify, collect, categorize, and report the data that you have systematically to demonstrate the value of school nurse-led case management to all your key stakeholders, people like your administrators, the school board, and any community partners, grant funders, stuff like that. School nurses need to know how and when to present this data. So identifying and categorizing and reporting I went too soon to that one. Identifying, categorizing, and reporting data systematically in a way that prevents useful information for school nurse-led case management program. Development, improvement, and sustainability are essential to have. Okay, so you need to identify, categorize, and report data in a systematic way. You have to do that. And one of the ways that you can do that is by using the 3S model. This is the student, school nurse, school community model. Okay, so this model helps you to identify and categorize data. It's derived from what's called the Donabedian model of structure, process, and outcome. Structure, process, and outcome, as you can see here. And we use this a lot in quality improvement projects, right? So we don't just measure the outcomes. The idea isn't just to measure whether or not the student had stable blood sugars. It's measuring all of the other components that led to that outcome are just as important, right? And so we have under the structure area, let me make sure that I have my correct information here. The structure measures are infrastructure and context-focused data related to the school nurse, the student, and the school community, and their capacity to provide care. So what do you have in place in the structure of your work environment, right? And the student environment. So take a peek at each of those components. How is care delivered under school nursing care? Who's supervised? What are the standards? In terms of the students, how at risk are they? What are their demographics? What acute conditions and chronic conditions exist? And the school community, what are the policies in place, resources that you have at hand? What is the structure of the district? And then in the process section, the process measures are the methods by which the school nurse-led case management and nursing care are provided. So how do you carry out care coordination and case management? Where's health promotion in the whole big picture? And what are the processes for this, right? Process measures are also focused on the timeliness, the accuracy, the appropriateness of care provided, and whether or not obstacles or mishaps occurred during the care delivery. So how you carry out the care. Is it done right away if it's a priority? Is it put off? Was the care provided appropriate for the needs, or was it something that you just thought was good? You didn't base it on any evidence? That kind of thing. Outcome measures look at whether or not the desired state of results from the care provided. So this is, for if you were measuring school nurses, it's did they keep their jobs? Did they have job satisfaction? Did the student reach their academic, health, or their satisfaction goals? And then in the school community, do we know what's the population health of the community? What's going on in the community at large? And then you're looking at also in addition to school data, you're looking at community data, state data, and then national data. So those are all in comparison to your local or in addition to your local. So we're going to look here at this particular example. Cut it off a little bit at the top. Sorry about that. So let's take a little look at this particular thing. This in this model, individual schools and districts collect data that are specific to the district and or community needs and priorities. We try, of course, to make the data align with what NASN wants us to measure in their Every Student Counts program. School nurses are trying to collect that data, so of course be cognizant of that and try and collect that data. You should also continually evaluate whether or not the data collected is useful and consider eliminating data points that they're not useful. Often I hear people say, oh my gosh, I don't know how to collect data. What do you mean by data collection? Well, this figure gives you a really good idea of how you can collect data in your particular district under the structure, process, and outcome formula or model, right? So you look at under the school nurse category, number of school nurses and support staff who you have working in your district, the ratio of licensed versus non-licensed, the type and amount of training everyone gets. And then in terms of students, look at your student demographics. How many students are receiving case management? Do you have a case management program? What are the procedures that are currently being performed? What's the absenteeism numbers right now? And then in the school community, you look at what is the structure and organization of our district, and do we need to change it? Is there an electronic health system? What's the physical environment like? And then in terms of process, this is specific to how you carry out the care of children in the district and case management. Are they timely? Are they appropriate? Who's doing what? Do you do home visits? Are there vaccination clinics? What are the interventions? And then finally, measuring your outcomes. Do school nurses do their jobs well? Is there satisfaction? Do kids have good grades? Do they meet their health goals? Do they have blood sugars that are within appropriate limits? And then what does the community look like? And what does the state and the national numbers look like also? So you can use this to consider how you would collect data in your own district. All right, so we also want to look at sources of data and reporting those findings, right? Student-related data can be collected from or entered into existing documentation systems, as we mentioned earlier. And we believe that you should advocate for an EHR if you don't have one. The student health record, whether it's electronic or static or paper-based, should be student-focused and not about the work of the nurse, right? It's not about how many tasks you did. It's about what happened with the student and what their reaction was to it. You need to always be thinking of like micro outcomes and then the macro outcomes, those long-term outcomes. It's imperative to use standardized nursing languages so that all of the school nurses are talking the same language and the measures are the same. So if I said, oh, he had good reaction and you said he had good reaction, my good reaction, how do I know what yours is and what mine is and how they compare? Right? So we need to be sure that we're all speaking the same language. And there's lots of examples of stuff like this in your textbook, out there on the web. You can decide on what you want it to look like so that everyone, and in this manual, so that you can be sure that everybody is speaking the same language. And then finally, reporting your findings. Remember that aggregated information, that's information on a whole, not individual student information. That's big picture information on the structure, process, and outcomes data is useful in understanding what is and what is not working, right? So you're looking at what is and what is not working in each of those categories. Then you can make adjustments at any point in the process where there are gaps or deficits. And then measures can be considered as a moment in time or over a longer period of time, depending on how you're reporting things. And so you should know how, when, and to whom to report the data. Some places that you might consider would be school board meetings, executive team meetings, if you can get on in those executive team meetings at the district level with the superintendent, to your boss and the other nurses, principals. You may also consider surveying parents and caregivers, teachers and staff to elicit their perspective on school nurse-led case management and its value, and then share what important information that you've found from those surveys and from your data of the program to administration and also community stakeholders. You might speak to people in the community who are grant funders or people who are also providing care so that they can support you better or understand what's going on in the school setting. Maybe you go to public health meetings. Maybe there's a committee that you do at your county level. And then finally, sustainability. Remember that data can demonstrate the value of school nurse-led case management to help students achieve their optimal level of health, academic success, and to support program sustainability. And so these are additional sustainability strategies that you might include, might think about and consider. Okay, so you can consider what barriers will you face and how can you consider those ahead of time in order to be prepared for them so that they don't knock you off your feet, when you're going along. Who is going to be a barrier? What types of barriers? It's not always financial. Sometimes it's people. Sometimes it's physical. What are the social needs of students and families and the social determinants of health, which is one of the goals, but it may or may not be a goal, but it might be something that's more big picture. Start building those partnerships within the school and within the community. Again, community resources, how can you avoid duplication of services, and then also leverage resources for the schools that might be something that's happening out in the community. Duplication of services is a major problem, and so we need to be working with our community partners and our healthcare providers to assure that we're not doing that. Be at the table, not just the seat at the table, be the person leading the table, participate in or lead the development of policies, protocols, and procedures that support school nurse-led case management. One of those is get your master's degree and develop a program that you implement in your district. So that all students can get this case management. You can get not just to the highest priority, but the high priority students. Of course, build on existing priorities. Look at those winnable battles. What can you win? Pick your battles, start small, and pick the winnable ones. That way you feel successful, people see you, you become more noticeable in the school setting. Be prepared to communicate what school nurse-led case management is, how it's valuable to students, how it's valuable to the district. And then as you're doing that, consider what messages would resonate with different stakeholders in the community to help you build and sustain school nurse-led case management to help students be successful in the school setting. Thank you for listening, and good luck with your school nurse-led case management program.